Dr. Andreone, thank you so much for joining us here again on Health Connection. Our topic today, foot pain, the steps to relief. You are a podiatrist. Please just explain the medical specialty that we call podiatry.
Well, podiatrist is actually a physician who is specifically trained to treat any and all conditions associated with the foot. Whereas in other specialties, maybe they're trained to look at other areas of the body as well. We specifically focus on the foot and ankle.
And so in your practice, what are the most common problems that cause people foot pain?
I'd say the most common ones are probably plantar fasciitis, ankle sprains, warts, ingrown toenails, neuromas, things like that.
So give us some examples of incidents, the things that happen to feet that cause, foot sprains, strains. How do you prevent them and how do you treat the pain when they happen?
Well, I think the term sprain and strains of the foot are synonymous with most overuse injuries or traumatic injuries of the foot. I'll give you an example. Someone who hasn't run in years all of a sudden decides they want to get in better shape, so they're going to go out and run a mile. Well, many years ago that was probably pretty easy for them, but after not doing it for a while, your body isn't conditioned to do that. So often they'll go out and they'll run that mile and they'll make it through it, but not too long after finishing, they notice that they're starting to have pain in their feet. Another very common issue seen is with people who have worked, say, in a job where they're required to sit for long periods of time, and then they take a new job, and all of a sudden that job is making them have to stand for long periods of time, and they're not accustomed to that. So not only they're having more stress on their feet, but they're also working on different surfaces, maybe a hard surface, and they're just not conditioned to being on that surface, so they're more prone to an overuse type injury of the foot. Typically, getting yourself in better condition, or if you've sat for long periods of time, maybe gained weight, losing that weight would be very instrumental in decreasing the load on your feet. And that can also be done, but I think it needs to be done smartly, where you work with like a trainer or a physical therapist, and you come up with a regimen where you can safely lose that weight and get back into condition. Along with that, wearing proper shoe gear is also very important. Something that's going to support your foot, give you shock absorption, and just relieve the stresses that are commonly seen in the foot when it's asked to do more activities than usual. Another way of doing that would be, of getting yourself prepared for that would be using non-direct impact exercises like biking or swimming, something where you're not going to have to stress the feet as much, but yet you can still get in better condition.
Okay. I think we've all heard of the condition called hammertoe, but let's get a definition. What is hammertoe, and what do you do to treat it?
Okay, well, a hammertoe is when the toe contracts at one of the joints in the toe. Typically, the most proximal joint on the toe, called the proximal interphalangeal joint, and the toe kind of flexes down. This can be caused for a number of different reasons. One can be the type of foot that you have. You could have a very high arched foot, and that can cause hammertoes. Another can be from types of shoes that you wear. If you wear like a sandal that's very loose, often women will claw at their shoes to keep the shoe on their foot, and that can cause a hammertoe too. Also, shoes that are too short and there's not enough room for the toes can actually shove the toes back and cause a hammertoe. Balance issues, people trying to flex their toes down so that they don't fall forward, is very common in the elderly population or people with balance issues. And another one would be neuropathy associated with like diabetes. Those patients will often claw at their shoes just because they can't feel the ground.
All right, so one of these did it to you. How do you treat it?
Well, treatment comes in a number of different forms, from conservative to surgical. Conservative treatment would be to give the shoe, of course, more room for the toes, so that the toes aren't pressing on the tips of the shoes or on the tops of the toes. There's also padding that can be done, because not everybody is actually a surgical candidate. And then in the advanced cases, or cases that don't respond to conservative therapy and the patients are surgical candidates, we go in and surgically straighten the toe, and that often fixes it permanently.
Okay. I think I can say with some confidence that we men live with the women in our lives, mother, girlfriend, eventually wife. They all seem to complain that their feet hurt. Mm-hmm. And it's usually traceable to the shoes that they wear. Let's talk about footwear and its connection to foot pain, and what should you look for with respect to buying shoes?
Oh, that's a good question. The There's some important rules for getting shoes. One is that they fit properly. Two is knowing the right time of day to get the shoes. It's better for you to buy your shoes at the end of the day when your feet are a little bit larger or a little bit swollen than in the morning. In this way, your shoes will probably be a little loose in the morning, but they'll fit you very nicely at the end of the day. If not, by the end of the day, if the shoes are tight in the morning, they're going to be very tight in the evening. You need to have enough room in the shoe for your toes so that your tips of your toes are not coming in contact with the tip of the shoe. And you need to have enough room to slightly even separate your toes in the shoe. If the shoe is too tight, it's just going to cramp the toes and you're going to end up with other issues like calluses and other issues. If the shoes don't fit properly in the store and you feel like you need to break in the shoe, it's typically your foot that's getting broken in and not actually the shoe.
Okay. And was I being sexist there, or is that true? Do women complain of foot pain more frequently than men?
I think you're right. I think that is associated with the types of shoes that women wear. They'll often make concessions to look very good, but not feel very good. And long-term use can cause issues down the road.
Okay. Flat feet, are they a problem? Can they cause pain in your feet, other parts of your body? And if so, what can be done to alleviate or avoid pain caused by flat feet?
Well, the foot is built like a Roman arch. All the bones set on one another and they form an arch. And those bones push against each other and allow you to have like a rigid structure to push off or jump. Yet when you are hiking or going on uneven surfaces, it also allows you to adapt to the terrain. When those joints and tendons don't line up properly and don't do their job, you can end up with a flat foot. And typically a flat foot, the arches in a person's foot will form between the ages of 6 and 8. A little later for boys, a little earlier for girls. Typically if they don't form those arches, they're going to end up with a flat foot. Not everybody that has a flat foot is symptomatic, but a lot of them are. And most of them won't notice it until they're skeletally mature in their later teens or maybe even their 20s or 30s, and they become very active. But the thing that causes problems is that the tendons are overworking to try to pull that arch up and keep the foot in a good position, and the joints are trying to line up, but with the flat foot, the tendons are losing that battle. And so the tendons get overworked, and then you start having pain, usually on the bottom of the arch or the side of the arch, and that pain just gets worse and worse the more you use it. However, when you get off your feet, it feels much better. In those cases, most patients are simply treated with an orthotic, which is a device that goes in your shoe. It's very thin, can be switched from shoe to shoe, and it holds that arch up, and it just takes the pressure off those tendons, allows the bones to line up properly, and it relieves a lot of the pressure.
Is the orthotic something you wear for the rest of your life, or do you get your foot back in proper condition and have no further need for the orthotic?
Often it's going to be that you need to wear that for the rest of your life.
Okay.
The muscles and the bones don't have any type of memory, but they will not hurt once they're held in a good position. They'll start feeling a lot better, the inflammation will go down, and you'll be able to do more and be very active with an orthotic.
You know, living life, things happen to us. You can have an injury. You're playing sports and you roll your ankle, or something happens, it hurts your foot. Can injuries like that bother us the rest of our lives or for a long period of time?
They sure can. Frequently, ankle sprains or inversion ankle sprains will cause tearing of some of the ligaments on the outside of the ankle. When those ligaments are torn, sometimes the tendons are also injured during that traumatic event as well. If not allowed to properly heal, it becomes easier to sprain or strain that ankle again. So once the initial injury happens, it's easier for that to reoccur. If you do not take care of it, sometimes physical therapy is warranted, where we actually strengthen the tendons around the joint so that they can make up for any laxity in the ligaments that are possibly torn or lengthened. So yes, they can cause long-term injuries where you could end up requiring surgery or even a brace.
All right, here's something that you see television commercials for, here radio commercials for, a condition called plantar fasciitis. What is it, and what do you do about it?
Okay, well, plantar fasciitis is very common. The plantar fascia is 3 fibrous bands of tissue that insert on the bottom of your heel, very dense ligament-type material, and that extends from your heel all the way to your toes. Those 3 bands actually start to turn into like 5 bands as it goes towards the toes, and it covers the whole surface of the bottom of your foot, and it actually helps support all the ligaments and tendons and bones in your foot. It helps form the arch. Now, when you have injury to that, say you go out and do something that you haven't done in a while and you overstretch it, or you've gained weight, or you had an injury, you stepped on something wrong, you can get these little micro tears in the fascia. Those micro tears cause inflammation. That inflammation causes pain. So typically the most prominent problem is patients are getting out of bed early in the morning, they take that first step and they about drop to their knees in pain. They don't know what's going on. They think they might have stepped on something, or they're often looking for glass in their foot. They don't remember injuring it. So they rest and it gets better, and then they take that first step down again and it hurts. But then they notice that after they've been walking on it for a little bit, it kind of eases up. Well, in those cases, we want to actually, one, check the structure of the foot, take some x-rays and look at their foot. Number two, we want to break that cycle of inflammation and pain. And we do that by having them stretch before they even get out of bed. And when they stretch and get out of bed, they don't step down on a bare floor or barefooted onto the floor. They actually step into something that's going to support their foot. So by getting them to stretch, support their arches, ice, all those relieve inflammation and will relieve the pain. But supporting that fascia will take that pressure off and cause that pain to go away. In most cases, most patients do very well. Sometimes they do require anti-inflammatories or steroid injection, but most cases do resolve. Can it come back? Yes, it can. If we don't take care of it and support it and continue that stretching and good supportive shoe gear, it has been known to come back.
Okay. You mentioned this earlier, being overweight, just carrying too much body mass. What does that do to our feet?
Well, during a typical person trying to, like, say, chase a little child or run to the mailbox, we're expecting our feet to handle 2 to 3 times its body weight. So there's a lot of stress on the feet. So anytime we gain weight, it always affects the joints below, typically the hips, the knees, and more so the feet. And in some cases, we can gain weight, and it can actually put so much stress on the feet that the arches will lose their form and they'll actually flatten out. And those cases, a lot of people will have a lot of pain. What's important during that time when you're having that pain is to support your foot and to keep that pressure, or at least keep as many of the abnormal stresses off the foot as possible. It's also a good idea to lose that weight, but to lose it in such a way that you're not increasing the demand on the foot. And that can be done by non-direct impact exercises like biking, swimming, elliptical, all those types of exercises which don't put a lot of stress on the foot.
Okay. If you were a dentist and we were having this conversation, you would tell me to brush at least twice a day and floss regularly. So, translate that to the foot. What are your recommendations to help us take care of our feet and avoid pain?
Good question. The number one thing I would say would be to inspect your feet daily. Just take a look. When you're getting out of the shower, make sure you dry between your toes. When you're looking in there, check for athlete's foot. Check for if you have any pain in your foot or if you have any issues or cuts. Address those issues quickly. If they're not healing or getting better in several days, I would always call my podiatrist to make an appointment and get it looked at, because sometimes in some conditions, the longer you wait, the worse the problem is and the harder it is to fix. The sooner you get it looked at, the easier it is usually.
All right.
So don't live in denial.
All right. Very good, doctor. Thanks for your time.
Thank you.